Can you really lower your cholesterol without medication? And what about supplements? Do products like psyllium, plant sterols, or omega-3s actually work, or are they just clever marketing? In this video, I'm going to walk you through 7 evidence-based ways to lower your cholesterol naturally without medication, including several changes that may be more effective than simply trying to eat less fat. In order to tell you the 7 ways you can lower your cholesterol naturally, it's important to understand that cholesterol itself is not the enemy. The truth is that cholesterol is absolutely essential for our body. Cholesterol helps form the outer membrane of your cells, and it's also used to produce bile acids, vitamin D, and several important hormones. Now, your liver makes the cholesterol that your body needs, while other cholesterol comes from the foods that you eat. If you do have high cholesterol, what can you actually do about these numbers? So that brings me to tip number 1 on how to reduce your cholesterol naturally. First of all, you want to replace saturated fat. Don't just cut out all fat. The type of fat that you eat matters more than simply choosing everything labeled low fat. Now, we know that saturated fats can raise LDL cholesterol. Major sources of saturated fats include fatty and processed meats, butter, lard, ghee, coconut oil, palm oil, full-fat dairy products, and many highly processed foods. Instead of simply removing these foods and replacing them with refined carbohydrates and sugars, you should make a deliberate swap towards unsaturated fats. For example, you can use olive oil or canola oil instead of butter. Choose nuts, seeds, or avocado instead of pastries or packaged snack foods. You can also replace some red or processed meat meals with fish, beans, lentils, or tofu. And you can choose leaner cuts of meat and lower fat dairy products more often. For most people, the saturated fat in the overall diet has a greater effect on blood cholesterol than the cholesterol naturally found in foods such as eggs. So rather than asking, how do I eat less fat? Ask yourself, what type of fat am I eating? And what could I replace it with? This brings me to tip number 2, eat more soluble fiber. So what if part of lowering your cholesterol could happen inside your digestive tract? When you ingest soluble fiber, it forms a gel-like substance in the intestine. This can reduce the reabsorption of bile acids, causing the liver to pull more cholesterol from the blood to make new bile. Now, good sources of soluble fiber include oats, barley, beans, lentils, apples, citrus fruits, eggplant, ground flaxseed, and psyllium. And a reasonable overall target is approximately 30 grams of total fiber each day, with around 10 grams coming from viscous soluble fiber. Psyllium, found in products like this one, is a type of soluble fiber that can be particularly effective. In fact, a meta-analysis found that a median dose of approximately 10 grams per day reduced LDL cholesterol by about 0.33 millimoles per liter. But here's a pharmacist tip for you. Be sure that you don't go from very little fiber to a large amount overnight. Many of these supplements suggest you take 4 or 5 capsules per meal. If you do this, you are more likely to get side effects like stomach upset and even diarrhea. You want to start this slow and increase gradually, and drink enough water to reduce bloating, constipation, and stomach discomfort. Give your body time to adjust, and that will help to reduce any unwanted side effects. In addition, psyllium can sometimes interfere with the absorption of certain medications. So check the product directions and ask your pharmacist how to best separate it from your prescriptions if necessary. Often it's just an issue of taking the fiber supplement at a different time than your medications. Tip number 3 on how to lower your cholesterol naturally. Build a portfolio of cholesterol-lowering foods. It would be amazing if one food could magically fix your cholesterol. This simply isn't possible, but several cholesterol-lowering foods can work together, and that is the idea behind this tip. Instead of searching for one miracle ingredient, build a portfolio that regularly includes things like a small handful of nuts, about 30 grams a day, beans, chickpeas, or lentils several times a week. Soy foods such as tofu, edamame, or unsweetened soy milk can also be helpful. Whole grains such as oats and barley, and plenty of vegetables and fruit. Also, don't forget unsaturated fats from foods such as olive oil, nuts, seeds, and avocado. These foods help in several ways. First of all, they provide fiber, plant protein, unsaturated fats, and naturally occurring plant sterols. More on that in a moment. They also tend to replace foods that contain more saturated fat. So this portfolio approach, along with other diets like the Mediterranean diet or the DASH diet, even well-planned vegetarian dietary patterns, all have been associated with improved lipid profiles and lower cardiovascular risk. The difference with this approach is that your results come from the overall pattern of eating and your daily habits, not from occasionally adding, say, chia seeds to a diet that remains dominated by highly processed foods and saturated fats. Start by choosing one repeatable substitution, say choosing oatmeal instead of a pastry for breakfast, lentil soup instead of processed meat, or nuts instead of chips, and then you can build on from there. The fourth way that you can help to reduce your cholesterol naturally is to consider plant sterols or stanols. Now, this is one supplement option that can produce a measurable reduction in LDL cholesterol. Plant sterols and stanols, also called phytosterols, are compounds that resemble cholesterol. However, inside the intestine, they actually compete with cholesterol for absorption. This means less cholesterol is absorbed and therefore less cholesterol enters the bloodstream. The Canadian Cardiovascular Society recommends approximately 2 grams per day as a part of a cholesterol-lowering dietary pattern. At this amount, plant sterols have been shown to lower LDL cholesterol by roughly 5 to 10%. Health Canada's review of 84 randomized controlled trials found an average LDL reduction of about 8.8% with an intake of 2 grams per day. But here's the important catch. You are unlikely to reach that therapeutic amount by eating ordinary plant foods alone. Plant sterols naturally occur in vegetable oils, nuts, seeds, cereals, soybeans, peas, legumes, fruits, and vegetables. However, a typical Western diet provides only about 200 milligrams per day, which is a small fraction of the 2-gram target. So, to reach the amount used for cholesterol lowering, you would generally need either a concentrated plant sterol supplement, which is available in forms such as capsules, powders, or liquid, or foods that are specifically fortified with plant sterols. Now, here in Canada, plant sterols are often added to products such as certain margarines and spreads, mayonnaise, salad dressings, yogurt, and fruit or vegetable juices, but you do want to watch out for the sugar content because you could end up with other problems if you're not careful. The cholesterol lowering response appears to level off at around 2 to 3 grams per day, and Health Canada considers intakes of up to 3 grams per day safe for adults. But unlike nuts or vegetables, you need to look specifically for a fortified food or supplement in order to reach the amount that has been shown to meaningfully lower LDL cholesterol. So what if LDL isn't the only number that is elevated? If your triglycerides are high, reducing refined carbohydrates, added sugars, and alcohol may be especially important. Tip number 5, reduce refined carbohydrates and excess alcohol. Sugary drinks, sweetened coffees, desserts, candy, white bread, and other highly refined carbohydrates can make it easier to consume excess calories and can also contribute to higher triglycerides. Try to replace these with water, unsweetened drinks, whole fruit, vegetables, legumes, and minimally processed whole grains. When it comes to alcohol, we know that alcohol can also significantly raise triglycerides in some people. If your triglycerides are elevated, cutting back or temporarily avoiding alcohol may make a meaningful difference. And what about omega-3 supplements? We do know that high-dose EPA and DHA, usually between 2 and 4 grams per day, can reduce elevated triglycerides. But this is a treatment level dose and it does not primarily lower LDL cholesterol. Doses above 3 grams of omega-3 per day from supplements should generally be used under medical supervision because of side effects and interactions, including an increased risk of bleeding in susceptible people. In other words, fish and other omega-3 rich foods can be part of a heart-healthy diet, but don't assume that an over-the-counter fish oil capsule is a substitute for cholesterol treatment. Tip number 6, move your body consistently. Now, this doesn't mean you need to become a runner or spend an hour every day in the gym, but you want to aim for at least 150 minutes of moderate to vigorous activity each week, and that works out to less than 25 minutes per day. Now, exercise may not produce a dramatic reduction in LDL by itself, but it can certainly improve triglycerides, HDL cholesterol, blood pressure, insulin sensitivity, and overall cardiovascular health. And the best exercise is not necessarily the most intense one. It is the activity that you can perform safely and consistently, something you enjoy. Tip number 7 for how to lower your cholesterol naturally. Aim for modest, sustainable weight loss if needed. Do you need to reach an ideal body weight before your cholesterol improves? Absolutely not. For someone carrying excess abdominal weight, losing approximately 5 to 10% of their body weight can improve triglycerides and may also improve LDL, HDL, blood pressure, and blood sugar control. The goal should not be a crash diet that you abandon within a month. We know that rapid, highly restrictive diets can be very difficult to maintain and may leave you losing muscle as well as fat. Instead, focus on habits that create gradual progress, like reducing liquid calories, increasing protein and fiber, cooking more meals at home, and controlling portions while you become more active physically. The change that works for 6 months will usually matter much more than following the perfect diet. But what about smoking, sleep, and stress? Although these 3 did not make the main 7 tips, they still matter. We know that smoking lowers HDL cholesterol and substantially increases cardiovascular risk. However, quitting smoking can begin improving HDL within just weeks, and it also provides benefits that go far beyond cholesterol results. There are a lot of smoking cessation aids at the pharmacy that you can ask your pharmacist about to help make this transition easier for you. Now, when it comes to sleep, getting sufficient sleep and managing chronic stress may not produce the largest direct reduction in LDL, but it can affect appetite, blood pressure, blood sugar, and your ability to maintain healthy habits and make good choices when it comes to your diet. So when it comes to cholesterol, you want to think beyond just your laboratory number that is on your blood test. The ultimate goal here is not to just produce a better cholesterol report, is to reduce your lifetime risk of heart attack and stroke. Now, the lifestyle changes we discussed today can be very powerful, but in some cases, you are really fighting your genetics and sometimes other chronic diseases that are just going to work against you, and sometimes you do need medication. Some people produce or retain much more LDL cholesterol because of their genetics. High cholesterol that runs in families can cause extremely high LDL levels from a young age and greatly increase the risk of premature heart disease. Medication may also be recommended if you already have cardiovascular disease, diabetes, kidney disease, very high LDL cholesterol, or a combination of other risk factors like lipoprotein A, for example. Taking medication is not a failure by any means, and medication does not replace a healthy lifestyle. The 2 approaches need to work together. So start with the changes that you can control. Have your cholesterol measured and work with your healthcare provider to determine what your personal numbers and risk factors mean. I hope this video has been helpful. Let me know in the comments which one of these 7 strategies you think would be easiest for you to start, and don't forget to subscribe for more evidence-based information to help you take control of your health. Thank you so much for joining me. Take care and stay healthy, and I'll see you in the next video. Bye-bye.